All right, it said it is live.
Okay. Good afternoon. This is the August 25th public hearing of the Joint Audit and Evaluation Committee. I am Delegate Carol Krim, the House Chair of this committee. I'm here with Senator Clarence Lamb, the Senate Chair. So welcome to all who are attending. Committee members, our Chief Auditor, Greg Hook, and his staff, and the Secretary of Human Services, Secretary Padilla, and Chief Judge Barbera of the Judiciary. Our agenda is packed. We will review the Department of Human Services audit first, then hear from the Secretary of Human Services, and then we will have questions, followed by the audit for the Judiciary and hear from our Chief Judges, and then questions. We will wrap up with a report from our Chief Auditor, Greg Hook. Senator Lamb, would you like to offer opening remarks?
Thank you, Delegate Krim. It's great to reconvene this joint committee again. I know that our legislative auditors have been busy at work and they have a lot to present. So I'm going to just be brief and turn it over to them. And Delegate Krim, unless you have any further remarks, I think we can just turn it directly over to our legislative audit team. We have Mr. Hook, Rubenstein, and Katz. It sounds like a law firm, but it's actually our state auditing.
Yes, thank you.
Mr. Hook.
Thank you. Good afternoon, chairs and members of the committee. For the record, I am Greg Hook, the legislative auditor, and it is both a privilege and an honor for the Office of Legislative Audits to be before you today to present the results of the two audit reports as described by Delegate Krim. Just to add on to the comments she made at the end of the meeting, I'll be making a remarkably brief presentation on the audit reports issued since the committee last met, and offering recommendations for letters of concern to be sent by the committee to 3 auditees. And you should have handouts for all 3 OLE presentations in the packet sent to you. So with your permission, we'll start with the June 3rd, 2021 audit report of the Social Services Administration. With me today are Eddie Rubenstein, the audit manager, who will make the detailed presentation of the findings, and Mark Katz, the audit senior, who will assist him. The audit report included 8 findings and resulted in an unsatisfactory audit rating, which means that OLA will, in about 6 months, perform a limited review to assess SSA's efforts to implement the recommended actions. In this current report, 7 of the 8 findings were repeated from the prior audit report, and in a number of cases, SSA or DHS had implemented certain corrective actions. However, although well-intentioned, in their final form, they were either not comprehensive enough or they're not adhered to by SSA. The written response from DHS on behalf of SSA accepted responsibility for the issues and indicated that appropriate corrective action will be implemented as a result of the report. Because of the results of this audit and the preceding one, I took the unusual step in the report cover letter of suggesting that the Department of Budget and Management's Audit Compliance Unit be consulted to assist in ensuring that adequate and appropriate corrective action is taken. This DBM unit is headed by an ex-legislative audit employee, and I have mentioned its existence to the committee before. Because of the role this unit plays in monitoring executive agencies in response to certain OLA audit reports, if the committee is interested, a future JAEC committee might include a presentation from this unit so the members can fully understand the role of this unit in resolving OLA audit findings. I'm not going to get into too much detail as I do not want to steal Eddie's thunder, but suffice to say that our SSA findings span several critical areas, including foster care, child protective services, and provider payments, amongst others. Also, a critical finding and the first report item highlights the need for SSA itself to implement a truly comprehensive and timely internal quality assurance process to ensure that its rules and regulations, so critical to safeguarding the children and establishing related fiscal accountability, are adhered to by its staff and the staff of the local departments of social services. Finally, although not a topic that we are prepared to discuss today, there is a separate OLA audit report issued on our audit of local department operations, which includes a summarization of the results of statutorily required DHS Office of the Inspector General audits of each local department of social services. The most recent OLA report was issued in June 2019 and included 8 report items and contained the totals of the OIG findings by areas of responsibility, including SSA, Family Investment Administration, financial management practices, and IT security. At the October 29th, 2019 JAC hearing, a letter of concern was sent to DHS about that particular audit report. With that brief intro, I will now turn it over to Eddie to present our detailed findings. Eddie?
No sound.
Eddie, you need to unmute yourself.
Thank you.
Eddie, we still can't hear. I can't hear you. Hey, Josh, would you want to jump in? Before Eddie
Hi.
comes back. Josh is our assistant audit director, and Eddie reports to Josh. Josh has a lot. Oh, Eddie, are you ready to talk now?
Can you hear me?
Yes, we can now.
Yeah,
Thank
yeah.
you, Eddie. Sorry.
I'm very sorry for that. I apologize. Good afternoon, Madam Chair, Mr. Chair, members of the committee. My name is Eddie Rubenstein, and I was the manager for the SSA audit. SSA is responsible for supervising, directing, and monitoring social services programs conducted by the state's 24 local departments of social services, also known as LDSSs. These programs include foster care, the adoption and guardianship programs, and child protective services. Slides 2 and 3 provide a brief overview of the audit, and slide 4 summarizes the key findings. As Greg mentioned a moment ago, 7 of the 8 findings in our report are repeat audit findings. I'm actually going to start on slide 5 with finding 1, which was that SSA had not implemented comprehensive and effective quality assurance processes to ensure that the LDSSs effectively administered child welfare programs. The LDSSs have numerous critical responsibilities with respect to these programs, including placing children with providers, ensuring children receive required services such as medical and dental care, and investigating allegations of child abuse and neglect. In our preceding audit report, we recommended that SSA develop written procedures for monitoring these programs and to implement a quality assurance case review process at each LDSS. In response to this recommendation, SSA implemented periodic on-site reviews to assess LDSS performance and compliance and develop certain written monitoring procedures. However, as evidenced by several of the other findings in this report, we determined that these actions were not sufficiently comprehensive to provide effective oversight. Regarding the on-site reviews of the LDSSs, we found that the scope of these reviews excluded certain critical LDSS functions, such as ensuring that safety assessments were conducted in a timely manner for substance-exposed newborns and for children born to individuals whose parental rights were previously terminated. We also questioned whether these reviews provided an effective means to ensure that LDSSs effectively administered the child welfare programs. For example, as I'll explain further in the next finding, there continued to be a lack of documentation to support that foster children were placed in the least restrictive environment and receive required services. We also noted that the procedures SSA developed were not always sufficient. For example, the procedures provided that SSA was to distribute various reports to each local department to assist with overseeing child protective services, such as investigating allegations of abuse and neglect. But the procedures did not address how these reports should be used to ensure that the investigations were conducted timely. Furthermore, we found certain inaccuracies with these reports, which further precluded effective oversight. Moving on to slide 6, which is finding 2. We found that SSA did not effectively monitor the LDSSs to ensure that foster children were placed in the least restrictive environment and received required services, such as periodic medical and dental exams. The LDSSs are responsible for ensuring children receive these services and documenting the services provided in SSA's case management system. SSA routinely provided a report to each LDSS that identified the services provided to each foster child. However, SSA did not use these reports to ensure that the LDSSs placed children in the least restrictive environment and actually received the required services. The table on this slide summarizes the results of our test of 6 foster care requirements for 48 children who were served by 13 different LDSSs. In total, we tested 214 requirements for these children and found that SSA could not provide documentation to support that 83 of these requirements had been met. We also noted that for 47 of these 83 instances, no supporting documentation was available, even though the LDSS had recorded that the requirement was met. The lack of documentation is particularly concerning, considering that the majority of these instances related to required medical and dental exams. For example, state regulations require foster children to receive an annual medical exam. We found there was no documentation to support that 29 of the 48 children tested had received an exam within the past year, including 9 children whose last medical exam occurred between 18 to 25 months prior. State regulations also require children to receive a dental exam every 6 months. However, SSA could not provide documentation that 37 of the children we tested had received an exam within the last 6 months, including 27 children whose last exam occurred between 9 to 26 months prior. Furthermore, 3 of these children had not had any dental exam since entering foster care between 2 to 5 years earlier. Moving on to slide 8, finding 3 was that SSA did not have an effective monitoring process to ensure that LDSSs conducted child abuse and neglect investigations and required assessments of substance-exposed newborns timely. While SSA distributed reports to the LDSSs to assist with monitoring the timeliness of these functions, SSA did not actively monitor these reports to ensure that LDSSs completed them within the required timeframes. In addition, our testing disclosed that certain of these reports were not always accurate. State law requires investigations to be initiated within 24 hours after receiving an allegation of child abuse and within 5 days after receiving an allegation of neglect. The law also requires that these investigations be completed within 60 days of when the allegation is received. Our test of 20 allegations of abuse or neglect received between May 2019 and December 2019 disclosed that 3 allegations of abuse were not initiated until 7 to 21 days after the allegation was received. Our test also disclosed that 3 allegations of neglect were not started until 6 to 14 days after receipt. In addition, 3 of the 6 lead investigations were not completed within the 60-day required period. Regarding newborns who are exposed to controlled substances, state regulations provide that the LDSSs are to examine these newborns and perform a safety risk assessment within 48 hours of being notified of their birth by a healthcare practitioner. SSA policy also requires the LDSSs to complete a family risk assessment within 30 days of being notified. According to SSA records, during fiscal year 2019, the LDSSs received 507 notifications of substance-exposed newborns. Our test of 10 of these disclosed that the risk assessment for 1 child was performed 55 days after the LDSS was notified. In addition, the family risk assessments for 4 of these children were performed between 36 and 70 days after the LDSS was notified. Next, finding 4 on slide 9, it also relates to child protective services. Specifically, we found that SSA lacked adequate controls to ensure that it timely notified the LDSSs when children born to individuals whose parental rights had been previously terminated by court order for abuse or neglect. SSA is responsible for providing the names of individuals whose parental rights have been terminated to the Maryland Department of Health. In turn, MDH is responsible of notifying SSA when children are subsequently born to these individuals. In those cases, state law requires SSA to then immediately notify the applicable LDSS to provide an assessment of the family and offer services if needed. During calendar year 2019, there are 252 children born to individuals with previously terminated parental rights. However, as of August 2020, the required assessments had not been performed for 144 of these children. We found that the primary reason these assessments were not performed was that SSA did not notify the LDSS of the children's births timely or at all. Specifically, SSA had not notified the LDSS of 50 of the 144 children, and for the other 94 children, the notifications did not occur until 7 to 19 months after SSA was notified of the birth by MDH. Moving on to finding 5 on slide 10. Which relates to federal funds. Under Title 4E of the Social Security Act, SSA is eligible to receive federal reimbursement for a portion of the cost of care for eligible children. We found that SSA did not conduct quality assurance reviews of Title 4E eligibility determinations made for children in the foster care or adoption and guardianship programs. We tested 55 children who were in these programs as of April 2020, and found that 8 foster children were incorrectly determined to be ineligible for Title 4E funding, resulting in a loss of $72,500 in federal funds. In addition, during our prior audit, we noted a significant number of children who were incorrectly determined to be ineligible for 4E funding. Consequently, we recommended that SSA conduct a comprehensive review of the eligibility determinations for any children who were deemed ineligible. However, SSA had not reviewed the determinations for any of the approximately 3,600 ineligible children who'd entered care prior to July of 2016 and were still receiving SSA services at the time of our review. If these determinations were inaccurate, SSA could potentially recover federal funds for a portion of the cost of these children's care. On the next slide, finding 6 was that SSA did not pursue the collection of provider overpayments. SSA's contracts with providers of group home services require those providers to submit annual financial reports to the Department of Human Services Office of Inspector General. The OIG then reviews these reports and notifies SSA of the results, including any overpayments identified. Our audit disclosed that the Inspector General had identified overpayments totaling $4.8 million made to 59 providers during fiscal years 2017 and 2018. However, as of October 2020, SSA had not taken any action to recover these overpayments, which had been reported to it by the OIG between 2 months and 2.5 years earlier. Next, finding 7 on slide 12. SSA had not established procedures to ensure that monthly assistance payments made to the parents of an adopted child were suspended when the child was subsequently removed from the adoptive home. As a result, duplicative payments for both adoption assistance and foster care could occur. This is significant because these payments are entirely funded by the state. In this regard, our test of adoption payments made for 5 children who subsequently entered foster care disclosed that SSA had not suspended the adoption payments for any of these children. We noted that the duplicate payments for one of these children was identified during our preceding SSA audit, but still had not been terminated. During fiscal year 2019, adoption assistance payments for children who entered foster care totaled $141,000, including approximately $43,000 for the 5 children that we tested. Finally, finding 8 on the next slide relates to SSA's monitoring of its interagency agreements with a state university. SSA had 3 interagency agreements with a university with a combined value of $15.4 million. We found that SSA did not verify certain billings from the university, including direct labor charges. This is significant because the billings under these agreements were primarily based on the actual time spent and salary costs of the university employees. This concludes our presentation of the Social Services Administration audit. I'd be happy to answer any questions from the committee.
Delegate Moon.
Thank you, Madam Chair. I just want to focus on this section of the audit report about delays in investigating abuse and delays in letting local agencies know that they need to be doing an assessment of abuse. Can you just go into further detail as to which aspects of this are repeat findings that have been problems before?
With respect to both of those processes, I think the entire process related to abuse and neglect investigations and notification of the locals is a repeat from our prior audit.
And has that been addressed in any way since notification again?
I think that would be a question for the department.
Senator, would you like to call on Senator?
Yeah, thank you, Chairman Krim. I know Senator McCray has had his hand up for a while. So Senator McCray, go ahead.
Thank you, Mr. Chair. I just wanted to get clarifications on the dates, if I can, Auditor Hooks. So you all conduct the audit you all give a presentation on the audit in 2017 from 2016 data. You identify a number of things that were problematic within the agency. The agency then comes in and you do a review in 2019 and says all these great things they're going to do about the findings from the audit that take place in 2017. And then here we are in 2021. The agency has 7 repeat findings on some very critical issues. I just want to get clarification in reference to the dates so that I'm sure when the agency comes up, I can get their responses.
Senator, I believe that is correct. And the follow-up we did that you referred to, that was a 6-month follow-up based on the last unsatisfactory audit back in 2017. And I believe our conclusion there was that most of the processes we reviewed were in progress. So on paper, what they told us, what they planned to do made a lot of sense. But as I mentioned in my opening remarks, either they ended up not being quite comprehensive enough when they put them in place now, or they didn't actually adhere to them. I think they had good intentions, but good intentions don't get you anything if you don't actually follow through. But yeah, you are correct. These issues have been going on for at least 4 years since the last.
Thank you, Auditor Hooks. Mr. Chair, I'll follow up my rest of my questions with the department. Thank you again.
Delegate Valentino Smith.
Thank you, Madam Chair. I just wanted to clarify, look, clearly all of us in 2017 were concerned, and we're concerned now in 2021 for what is a very vulnerable population. But I just want to clarify that in the audit scope and objectives in the methodology section, that you don't use a statistical sampling as a general rule, that you accomplish the objective just using a smaller set. So we can't do any kind of statistical analysis as to the extent of the problem, but that this confirms that there is a problem, but it could be really more significant than what we're seeing with just this very small case sampling. Is that correct?
That is correct. But I think in a number of these cases, based on the issues, I think we just deemed if one child was at risk, that was clearly a big problem. But you are actually correct. Yes.
Okay. So the conclusion is that although we're seeing some very significant findings for failures for some children, it really could be, look, we don't want it for just one child, but we could be looking at significantly higher numbers of failures for children in the different local areas.
That's correct. But I think to do what you were talking about with statistical sampling, we might actually have to do a statistical sample at each of the 24 local departments, because I have to project the results of one to another. But I
have a proposed different solution, but I suggest that it's probably better, Mr. Chair and Madam Chair, that I wait until the department comes forward. So thank you.
Thank you, Delegate Valentino Smith. Next, we'll go to Senator Eckert.
Thank you very much, Mr. Chair, Madam Chair. I just had a technical question on how you collect the data. Is it taken from hand accounts, or is it taken from computer programs? Because I think historically we've had issues with Chessie, and I thought we had switched over to a new system. So I'm just trying to figure out how, I think that plays a role in this, but I'm not sure how you collect your data when you're doing your sampling.
Senator, well, Eddie, let me just jump in real quick. Senator, you're correct. In the response to the prior audit report that Senator McCray spoke of, they did allude to the fact that Chessie did have inaccuracies and they were going to be segueing to a new computer system that had more functionality. But I think we had a comment in the current audit report that due to the timing of the implementation of their new system, we basically looked at the information that was on Chessie, which is what they were using for the vast majority of our audit period. And Eddie, you can speak to that in particular, but I believe there is a paragraph somewhere in the background of the audit report that speaks to that exact issue. But Eddie, do you want to answer?
Yeah, so just to add on to that, I would say with regard to the system reliability issues, I guess first to answer the question, primarily we're pulling data from Chessie, their records, but as we noted in several findings, Chessie was not always accurate. In those cases, we did go back to paper documentation and things like that to verify the things that we were seeing, to make sure we had the correct dates and so forth. With respect to the validity issues that we're seeing, though, I think they can be probably categorized into two groups. One is the issues with the reports themselves, which I think were noted last audit and not necessarily addressed because CJAMS was on the horizon. I think the position was, let's not fix it when we have something new coming. But then the other category is a lot of this comes back to data entry. It's a caseworker or someone at the local department who's doing something and then has to input it manually into the system. For example, in the second finding where we're talking about were required services provided, we found instances where they recorded that something was done, but there was no documentation to support that. So I think it really is both problems at play there.
Okay, so has CJAMS been fully implemented down to every front line in our local DSSs?
My understanding is that it has. At the time we were doing our review, it was only implemented on a very limited basis. And probably the department could provide a more current update.
Yeah, that's just what I'm trying to figure out, because I know this has been an ongoing battle. And then you surveyed when the end of 2019, correct?
Correct.
Yeah.
Although we were looking at current processes, it's just the data and the payments primarily were from Chessie.
Right. And then, yeah, I was just wondering how much staff turnover was and how much time there was to, do the trainer to get everybody fully up to speed on doing that new way of data collection. So it's almost like we still had a perfect storm, and then we've had a few hiccups since then. Anyway, thank you very much. I'll check with the department, but I was just curious what systems were. Thank you.
Senator, on page 8 of the audit report, we say that Chessie was officially decommissioned during December 2020.
Okay. That's
Delegate Harrison. Delegate Harrison.
Yes, good afternoon. Thank you. And hello, everyone. I'm not sure if my question really should be more for the department, but, first diving in to these audits, obviously it's concerning to see some of these things as it relates to children. I'm concerned about the budgetary issues, but I'm more concerned about the children. And so in the last audit report, if I remember correctly, it said that there were still some repeat findings from a previous audit report. As it relates to the children and ensuring that the children actually are being taken care of in the way that they should, did the department come back and say anything to the effect as to how they're going to ensure that these children are taken care of, or, you know, whether it was a personnel issue, not enough people. I'm just really trying to get an understanding, and it may be a question for the department, but from the auditing standpoint, I guess I'm curious as to know what the department may have said as it related to those particular issues, and how we're ensuring that these children have what they need.
So I think, as Greg said in his introductory comments, SSA acknowledges the need for improvement in these areas. And also, as Greg said, I think they had taken some steps towards establishing a process. It just wasn't always effective or adhered to. And so from an audit standpoint, you know, written procedures are worth only that. It's you really have to follow them to make sure that the outcome is what's intended. So I think, to answer your question, they can probably elaborate more on maybe the cause for why some of these things were not followed, or and what they intend to do to fix it. But from an audit standpoint, they just did not adhere to or establish an effective process.
Okay, thank you. I'll come back.
Well, I think the agency could respond, but I would like to add a personal comment, if I may. I have a sister-in-law who works at a local Department of Social Services, and I've heard stories, and hats off to those frontline caseworkers. They do a tremendous job. I think they're all very dedicated, but she talks about burnout, understaffing, and this is just what I've heard third hand. And even herself, she needs to recharge her battery. She left for a couple of years and then went back. It's very difficult. And what we're really talking about here are two different things. One is the caseworkers at the local department making sure they do the job, and then SSA making sure the local department's people do the job. It's actually two different things we're talking about collectively. But it could very well be a staffing issue, you know, a number of caseworkers, and you know, they can certainly speak to that. I just wanted to add that personal perspective, that's all.
Okay, our last question is Delegate Kittleman.
Thank you, Madam Chair, and thank you all from the audit department. I think you do a phenomenal job, and I love reading the audits. My question is very similar to that of Delegate Harrison. Because there were so many repeat findings that persisted through more than even 2 audits, do you ever ask the department why it has not been fixed? I didn't know if you do that, but.
Delegate, I went back, Eddie, hold on a second. I went to look at the 2017 SSA audit report, and I'm looking at the table of contents now, and there are actually only 2 repeat findings from prior to that. And one was on the interagency agreements, and one was on the federal fund drawdown numbers. Okay. So all the other issues that showed up in the 2017 report, and there were a lot of them, that was the first time they were shown in a while. And now they've been repeated for the first time. So I just wanted to clarify that these issues may be 4 years old, maybe 7 years old. I just don't know how much, but they did not repeat from 3 audits ago.
Greg, Brian Tan, I just wanted to add that the audit report before that, so 3 audit reports ago, there were only 3 audit findings. And you know, we did repeat two of those 3, but there were only 3 audit report findings 3 audits ago. And then it increased significantly last audit, resulting in the unsatisfactory, and that seems to be the same status now during the current audit.
So you don't really ask why, I suppose. I mean, it's the same question is that you have the departments telling you what they will do. And then when they don't do it, and you have to tell them the same thing again, even if it's only from 1 to 1. I was just curious, do you ever ask why, or do you just leave that to the departments to follow up in their response?
We do include the clause when it's applicable in our findings. So a lot of times we will do that. But as you can see from the prior status report and the current report finding, the department was in agreement and indicated that they were going to, you know, they were making strides towards addressing these findings. Generally speaking, we include the clause when there is a difference of opinion. They'll provide a reason for why something took place. We may or may not agree with those reasons, so we include those in the findings.
Okay, Thank you.
Thank you. We're going to hear from.
Madam Chair, for the record, can I just identify who that was who was speaking besides his name?
Oh,
that was
okay.
Brian Cannon, and Brian is the director of our Compliance and Performance Audit Division, who's actually calling in, I believe, from Queens, New York, after dropping his son off to college today. So,
Thank you, Brian. Now we will hear from the department. Secretary Padilla, you're up. You can introduce yourself and your team.
Good afternoon, Chairman Lamb, Chairman Krim, and members of the Joint Audit Committee. I'm Lourdes Padilla, Secretary for the Department of Human Services. And today I want to thank you for the opportunity to respond to the audit findings related to the Social Service Administration Child Welfare Program for the period beginning July 1st, 2016 and ending April 30th, 2020. I have my team with me today, Greg James, Deputy Secretary for Operations, and Michelle Farr, Executive Director of the Social Service Administration. Also with me is Brandy Stockdale. She's the Director of our Baltimore City Department of Social Services, who's available to speak to your questions and provide the real world context to the work we do. You have my testimony, which I won't repeat here. DHS and SSA continues its commitment to program integrity and compliance, espousing an environment of safety and learning which allows for course correction with transparency, buy-in, and collective accountability. We appreciate the feedback in this audit, noting the improvements that have been made, as well as pointing to the areas we need to continue to improve. We have successfully resolved 6 findings from the previous audit. In addition, OLA noted SSA's compliance with monthly face-to-face visits with children in foster care, ensuring that all children in our care are consistently being monitored. We believe that many of the issues identified in the current audit are indicative of administrative activities related to documentation challenges rather than service delivery deficiency. A number of corrective actions have been proactively implemented to address the issues identified. And we believe that as these actions have time to take hold, they will have a positive impact on future audits. Key strategic initiatives implemented to address these audit findings include statewide rollout of the new Child Juvenile Adult Management System, or CJAMS, to replace our old Chessie Child Welfare System. The rollout was implemented in July 2020 after this audit ended and gives us better tools to monitor a wide range of child welfare activities. SSA also established an SSA audit unit with the responsibility of ongoing monitoring for compliance to include enforcement and escalation as needed. These auditors' findings fall in 3 general categories: quality assurance process and monitoring, child protective services, and fiscal issues. I would like to take this opportunity to review each category and the corrective action being implemented to mitigate the findings. With regards to our overall quality assurance process and monitoring of activities at the local department level, SSA has continued to strengthen its quality assurance and monitoring processes. Since 2018, SSA has implemented the federal required child and family services reviews with each local department of social services. Through these reviews, SSA has achieved 7 out of the 10 federally identified outcomes. This reviews allows for ongoing continuous quality improvement for all local departments. And as an enhancement to this process, SSA implemented a standardized quality assurance process designed to monitor key child welfare activities and ensure that services are accurately documented. To support the effective implementation of this process, a number of tools have been developed, including a standardized review tool and standard operating procedures to detail review protocols, as well as processes to enforce compliance and corrective actions as needed. In addition, with CJAMs, we increase the use of mobile technology to support real-time documentation and updated key policies, ensure alignment with federal and state requirements, as well as to clarify documentation expectations. Turning to the findings related to the Child Protective Services, as an immediate response to the concerns identified in the audit findings, SSA enhanced its monitoring process to track timely initiation of investigations and closing of cases, utilizing CPS milestone report that includes data related to these benchmarks. SSA refined policies and guidance and continues to provide technical assistance to local departments. With regard to the timely assessment of the substance-exposed newborns, to address this issue, SSA revised a SENS policy to address timely completion of required assessments and provided training on the implementation. We're enhancing our CPS milestone report to develop a tool to assist with monitoring timely SENS assessments. With regards to child born to individuals whose parental rights have been terminated, DHS understands the importance of the timely assessment of children born to individuals whose parental rights have been previously terminated, has taken the necessary steps to ensure that assessment of the 145 children identified in audit and will be completed by September 2021. In addition, we have dedicated a staff person to implement this process in partnership with our audit unit. The remaining findings deal with issues of fiscal management. DHS is dedicated to ensuring fiscal responsibility and accountability. With regards to the issue of 4E eligibility determinations, SSA is conducting a comprehensive review of all active foster care cases in CJAMs related to Title 4E eligibility and maximizing federal reimbursement. To date, 58% of foster care cases have been reviewed. 58% of the review completed, none were found to be incorrectly determined ineligible, indicating no loss of federal funds. SSA is also utilizing CJAMs to ensure that Title 4E eligibility determinations and redeterminations are accurate and in compliance with federal and state requirements. CJAM now has the capability to assist in verifying that Title 4E eligibility determinations are accurate and in compliance with federal and state requirements. With regards to the cited issues with adoption subsidy payments, SSA has reviewed all children who re-enter foster care from adoption to confirm payments were appropriately suspended. This review identified 73 total cases, of which 13 were receiving state subsidies, which should have been suspended. SSA notified our local DSSs to immediately stop payments and we're exploring the feasibility of recouping payments. To prevent recurrence of this finding, functionality in CJAMs has been developed to automatically stop state subsidy payments when a child re-enter foster care. So this should not happen again because it will be automatically stop the state subsidy. With regards to the payments to providers, to ensure that provider overpayments are immediately identified and recoupment is initiated, SSA has identified staff person to monitor provider payments and establish a joint standard operating procedure with Office of Inspector General and Budget and Finance. With regard to the finding related to agency agreements, SSA and Office of Attorney General at DHS have modified the agreements to include notification and approval of any changes in key staff and have sent a notification to UMB regarding this requirement. In addition, an SOP has been developed to outline the procedures for monitoring contracts and approving invoices, which will be issued in September. Thank you again for the opportunity to present here today. I want to reiterate DHS commitment to its oversight and monitoring responsibility. We appreciate the audit as an opportunity to identify areas for growth and improvement. I want to leave you with and ask, it takes time to create organizational change, and that's what I'm creating. And update your processes and technology. In this case, I believe that we're making progress and having completed the technology transformation and with process changes well underway, we're on the right track to make Maryland a model child welfare system, which I know is totally different than what you feel today, but we are and we will develop a model child welfare system. I will be happy to address any questions the committee may have. Thank you again.
Thank you, Madam Secretary, and thank you for being here and your staff. And bearing in mind what Chief Auditor Hook referenced earlier as the extraordinary work your department has to do, and we depend on you. And that's why we're going to question you here today about taking care of Maryland's vulnerable children. So this audit, as you know, was published in June. Can you tell me here today what further steps you have taken to ensure that investigations are done in a timely manner? I'm talking about the children born to people who have had their parental rights taken away, and also neglect. So can you tell me what you've done since that time? And can you sit here and assure me today that those children are being taken care of as we sit here today? Thank you.
Thank you so much, Chairman, for the opportunity to address your concern and the committee concern. I can tell you that what we have done thus far is, as I stated before, this is a story about documentation. So when I answered the question, I want to be clear that we are not saying that the children have not been served, that the children have been harmed. What we're saying is that the documentation was not there when the cases were reviewed. And one of the key things that we have done is with the one that I alluded, that we've been working for years, is modernizing our technology. So our workers had the tools that they needed to do to document the good work that has been acknowledged by the Auditor Hook they're doing out in the field. One, we have given them the tools, the iPads, so they can go out when they are investigating, they can go out and track and enter the information in real time, which they did not have before. Imagine you go out in the middle of the night, you're looking for a family, you can't find it, or you do find it and serve the family. You go back sometimes on a weekend, right? You go back on Monday, many times they did forget to enter and track the information and document that the services were provided timely. Now they have the tools to do so, to do it in real time when they go back to the car to enter the information and track the documentation. In addition to that, when they do, there's technology that also tracks the information and allows us to then receive reports for the supervisor, for the managers, for the local DSS, that accountability, that monitoring, that is so important that they can look at the reports and hold the workers accountable. I can hold the directors accountable, and you can hold me accountable.
Okay, so you're telling me today that since June, and I'm just putting you on the spot from June until now, because that's when the audit was published, that you have gotten iPads for your staff, and now you can tell me that because they have the iPads, all these children now are being assessed, and all the investigations are occurring timely according to law. Is that correct?
That's one of the things that we have done. Not just the thing. There have been many other things that we have done, including training, but I'm going to stop here and I'm going to let my Director for Social Service Administration to elaborate on what they have done in SSA.
Okay, if I could just get Chairman Lamb to come in and offer his question. Maybe she can answer them both at the same time.
Sure.
Sure. So thank you, Chairman Krim. I share the same concerns, and I find the findings in this audit to be pretty alarming. You know, particularly the fact that this is stemmed through to a prior audit as well. And it sounds like what you're conveying is that you're trying to provide us assurance that the services are being provided as appropriately required by the agency, but that you simply have not had the opportunity to properly document that. I think that's concerning. You know, I come from a medical background. We have to document everything. And, you know, if it wasn't documented, it didn't happen, right? And so that's all that the auditors can really go on. And I would be more willing to excuse that if it was simply one finding that wasn't properly documented. But this is finding after finding after finding that was not properly documented. So almost half of all kids, for example, have not had a medical examination. You know, only 69% of children are assured to be safely maintained in a home when possible. And the list goes on and on. And so it seems like either a wholesale failure to be able to properly document anything within the agency, or that there are actual lapses in services that are being provided across the board to these children who are really in need. Is that what you're contending, that this is really just a documentation problem?
Well, before the director goes on, I want to make sure that I'm making clear that I was answering the Chairman Quinn's question. I was not answering the health services question. That would be a totally different answer. But on the other, the monitoring, it's the documentation. One of the reasons why when the auditors came in and couldn't find what they needed to document whether the services were provided or not, I'm saying that one of the key factors was the documentation, and it's not something new. I mean, we have been talking about for 4 or 5 years the need for us to modernize our technology system because it was failing us, and we were getting inaccurate reports, or there was no report, or as I said, the workers really didn't have the tools that they needed, or when you have workers spending a lot of time documented, then you can agree with me that it takes time away from serving the client, the child. So we work very hard at aiming that the worker had more time in their hands to actually provide services to the child and less documenting via manual effort. Michelle, if you would elaborate, thank you.
Absolutely. Thank you so much, Chair. And Madam Chair, for your questions. I'm Michelle Elfar, the Executive Director of Social Services Administration. And I concur that I believe the modernization of our technology, not just the mobile technology, but also our system of record, is really going to aid us in being more successful in our documentation and our management of our data and our ability to ensure the monitoring and the compliance of all of these findings. I want to be very clear in understanding, and I respect Mr. Hook and his concerns related to the staff person. I think that there's a culmination of things that could obviously impact the way we do our work. However, what I will share with you is that when we are going out and doing our 24 hours or our 5-day investigations, initiating those, we are doing that in a lot of times with our law enforcement, but the documentation with respects to our law enforcement seeing an alleged victim is allowable by family law. However, it may not be enclosed in our system of record, right? And so there are reasons why, and there are good reasons why we're not able to document. We think about those families, I think the Secretary alluded to, families that we're out there trying to see throughout the day, 24 hours, we're unable to locate them. And so though we are making reasonable efforts to be able to see these children and to see the families, if they're not available and we're not able to document us being able to see them, then we're not obviously getting the credit for making timely initiations. And so there are a lot of times that we're unable to locate families and children, unable to access children, but at the end of the day, the efforts are being made, and I can confidently say that our staff are going out to see these families, but there is a challenge with accessibility to them, but there's also a challenge in our documentation as well. I think that with respects to the concerns around the birth match, we did review all 144 cases that were identified in the audit. And with respects to those jurisdictions that were impacted by that, we reached out to them to ensure that those assessments were done. We stated that we would get those assessments done by September of 2021, but I'm pretty confident that we're going to be able to complete that in advance of that deadline. Our goal, again, is to ensure that we have a multi-tier process to make sure that we're able to meet that requirement. And that requirement is that we have a policy analyst that is dedicated to the birth match process to ensure that we are notifying our local departments on a weekly basis, and that we're then having a director to review all of the birth match notifications on a bi-weekly basis. And then of course we have our office as a whole, our Child Protective Services Family Preservation Office, that maintains a master list of all of the birth matches. So we're tracking that now as we're notifying our local departments. And so the office also tracks whenever the local department has initiated a timely assessment with the family and what the status of that is. And so we are increasing our monitoring and the compliance as it relates to those 144 birth match cases that were audited by our partners at OLA, but this is an ongoing process moving forward. We have implemented something, we have dedicated a staff person to do this and to do this solely. And so feeling much more confident, if you will, with respects to how we are managing our birth match process. With respects to the comments related to medical and dental and educational services, we have been, again, utilizing our CJAMs, our new record of system of record, to support us in identifying and tracking our success with regards to that. We have developed that functionality so that we're better able to capture the medical, the dental, and the educational information. We also, though, have implemented, and I think you heard the Secretary say, a QA process that now is taking us beyond what the federal requirements are related to just 18 elements to now over 60 elements total, and being able to ensure not that we're only looking at medical and dental or educational services, but we're also looking at the timely initiation of our investigation, our timely closures, as well as our SINS assessments. And so as we continue to move forward with these enhancements and with these tools, our goal is to be able to also ensure that we are documenting across the board what these findings have represented to us all today. I do want to say that part of our partnership with regard to our educational services, that we are partnering very closely with the Maryland State Department of Education and also local education agencies to enhance our coordination around enrollment as well as education services. We are also partnering with our managed care organizations to ensure that there is ongoing communication and coordination with our local departments, that's occurring, it's consistent, and that we're documenting that accordingly as well. And so again, as we're looking at our milestone report, as we're looking at the integration with our new system of record, and when we're looking at just our overall audit unit that is really there, dedicated solely to ensuring that we are meeting the mark with regards to these findings, as well as other benchmarks that we are required to ensure compliance, I think that we're moving in the right direction, and I do see traction in terms of the areas.
All right.
Thank you, Ms. Farr. I do have follow-up, but I think in interest of time, I'm going to turn it over to the other members for questions. Maybe we can start with the senators this time, Chairman Krim, and we'll start with Senator McCray.
Thank you, Mr. Chair. Thank you, Madam Chair. Madam Secretary, I'll get straight to the point. I'm going to focus on two issues just to be very particular to my colleagues' time, but there are a number of questions that I could ask throughout this report. I just want to lean in by saying Diamante Driver. For those folks that do not know and think about the dental exam, that routine dental exam that did not take place for this young man, this young jewel within the state of Maryland that we do not have here with today, this report is very, very alarming. I know that I heard several times that this is administrative versus delivery, but the reality is that we don't know whether the delivery is going on the way it's supposed to be, because that's the safeguard. The administrative part is the safeguard. I just wanted to lift that up. Madam Secretary, I looked at 2017 very in depth. I looked at your responses in 2019 very in depth. And I looked at the audit that we have here today in 2021 very in depth. And when I think of 2017 and I think of 2021 right here, I just want to read you some of the percentages. Medical exams in 2017 was 38%. So that means documentation for your agency at 38%. 2021, that number is 60%. So just recognize that got worse. Let me go on. Dental exams. Dental exams for you not keeping documentation in 2017 was 45%. In 2021, it's now at 78%. It's gotten worse. Even for those young people that were not documented for attending schools, it was 51% in 2017. And I think that all my colleagues would agree that 43% is still unsatisfactory in reference to keeping documentation for our young people going to school. I want to read your response in 2019, the things that you said you would put in place in order to make sure that we were keeping documentation. You said in April 2018, SSA conducted a webinar to guide local departments on documentation of the education and health folder in Maryland-Chessie. You also said in May 2018, SSA began monitoring compliance of education, health, and dental information via monthly out-of-home milestone reports. SSA is documenting the monthly trends and will utilize the information to identify training and technical assistance. So to get to the point, Madam Secretary, in reference to this question, the question is, do you believe that this is a vulnerable population? Do you believe that documentation, that those safeguards are very important? And the things that you put in place that you told us that you were putting in place when be it that 2019 report, help me understand how it got worse instead of better.
Thank you, Senator McCray. Yes, I do believe that this is a vulnerable population. I do believe that it is very important that the dental and the medical services that they are entitled to are provided. I can tell you that there are challenges to that. And I'm going to have my Secretary for Operations to speak a little bit about the challenges getting the services to the children. But as far as why it has gotten worse, this is exactly what I've been talking about when I have tried to address the documentation and the correct tracking of what was being done. the system is not working for me. I've been getting incorrect reports. Now I feel that with the new system and having us being able to provide the data elements that we needed to correctly and accurately provide the right information is why I feel so hopeful. But what you just mentioned, we went from 50 to 78. And I'm not going to argue with you, Senator, because numbers are numbers, right? That's something that we have learned. Numbers are number, data is data. What I'm saying is, can we sit here and debate whether the data was correct or not? Maybe we can, because I have said all along, I have never come to you and said the data is 100% accurately, because had it been accurate, I would not have been asking for funding for a new system. Mr. James, if you would elaborate on the challenges that our children have and our foster parents have.
Certainly, and I think at the risk of being a little bit redundant here, I do want to stress what Chairman Lamb said is correct. What you've said is absolutely accurate. The documentation and those administrative processes are critical, because as you said, we can't tell the difference between that child who's received the service and that child who is still in need of that service if we don't have the documentation to back it up. Prior to CJAMS, what we had was basically a mix of some scanned documents, but basically in an electronic file cabinet that was not real different than the paper file cabinets. We had a lot of paper files. We had other data systems used by other partners to help us monitor our compliance. With the information spread out across all those systems that way, it is almost impossible to accurately monitor what's going on. We had to do a lot of hand counts and a lot of sampling, and that's not really going to get us to the level of compliance that we need here, which is why with CJAMS, one of our critical functions was integrating not just here's a date where something was done, but by the way, here's the attached document. Because, I can say, oh, it's in that file, but there's no way for me to look at a paper file and tell whether or not a document is in there and whether it's accurate. If I have that directly integrated with CJAMS, which I do, I can see the required documents are attached. And this goes all the way through the system and a number of different findings. So we'll be able to better monitor that, to monitor compliance and give our supervisors and senior leadership the ability into the activities to say, this is the accurate percentage of children who have received their treatment, who have received their medical appointments, who have received their dental appointments.
I'm going to have to step in here. Yeah, I'm going to have to step in here. We're running out of time. We have like 10 questions here from, maybe not 10, but we have a lot of questions here from the committee. So Delegate Bolokovich-Carr, could you have your question, please?
Thank you, Madam Chair. Thank you, Mr. Chair. On a point of personal privilege, it's a pleasure to be here for my first time in one of these meetings as the newest member of the Joint Committee. So this question is for Administrator Farr. You had previously mentioned that in terms of the birth matching records, there was now, I think, a weekly or bi-weekly monitoring going for that particular program. The audit, the agency's response to a number of the audit findings mentioned that there was going to be this periodic case review process, as of December 2021. Does that mean that for the other findings, that there will also be similar weekly monitoring to check to make sure that the local service providers are providing the right documentation?
So the quality assurance program and the audit that the auditor referenced is a process that we have added that will occur on a bi-monthly basis. And I have my program director available to confirm that. And that is in conjunction with what we do on a monthly basis with our CFSRs, which is our Child Family Services Reviews. So that's separate and apart from what we're doing with respect to our birth match.
Thank you.
Chairman Lamb, you want to Senator?
Yeah, if we can go to Senator Augustine.
Thank you, Chairman Lamb, and thank you to the committee and to everyone who's here. Secretary, I've listened to all that has been asked and heard, and the system will only be as effective as the inputs and then the monitoring, obviously. And of course, that was the situation in the past. What I have not heard from you all is an acceptance of accountability for these shortcomings. I haven't heard that you are going to change a culture that we will not allow for these kinds of things to happen. Systems don't matter one way or the other. Can you address that? That I have got that sense, that I have the feeling that you, based on these years that we've seen, that this is where you are. Can you address that for me?
Thank you so much, Senator, for giving me that opportunity, because I believe that when I did my closing remarks, that's exactly what I spoke about. Organizational cultural change and accountability goes hand in hand. And absolutely, can we do better? Absolutely. I'm not here saying it's all documentation and there was nothing that we could have done better, because that's not, and if I'm giving that message, I apologize, because that's not the message that or the response that I want to offer this committee today. What I'm saying is I came to this department in 2017, exactly when the first audit report was issued. And I came to this committee and I said, and I outlined what we intended to do to remedy all the findings. And I'm saying we are on track with the remedy. The fact that we were able to successfully address, and admitted by the auditors, address the findings is indicative that we have been working very diligently toward addressing the findings. Absolutely. Accountability, I spoke about. I'm going to hold my workers, I'm going to hold my supervisors, I'm going to hold my directors, and I'm going to hold ultimately myself, and you're going to hold ultimately myself too. Absolutely. Accountability is very important, and it goes hand in hand with everything that has been said today.
Okay. Thank you, Madam Secretary. Delegate Valentino Smith.
Thank you, Madam Chair. Look, we're running short on time, and I appreciate that. I had several questions, but in lieu of that, I would like to make a statement and a request, a very serious request. I too, like Senator McCray and many of you, have been reading the 2017 response and the absolute assurances that you had a CQI process in place that would take care of monitoring and doing performance evaluations that seems to have failed. I appreciate the testimony that you believe these are documentation challenges rather than severe service delivery deficiencies. However, unfortunately, given the review, Mr. Hook indicated that we have of several other budgets that have been before this committee, including the family investment budget and the other audit findings of DHS that tend to indicate systemic problems with deficiencies in delivering services to this population. I think at this time, rather than wait for continued monitoring to see whether the CJAM system and documentation alone cures this problem, that we do not have the time based on this vulnerable population and the systemic audit findings throughout the department. And that rather than, as Mr. Hook said, he's asked DBM to come in and assist with the auditing. I think auditing, Madam Chair, means that we're just waiting for after the fact findings. And I think now we need to ask the executive branch, demand that a monitor be sent in immediately to this department, because it is not this secretary's individual responsibility. As she testified in 2017, these problems have spanned 2 administrations and more. And when we hear, because I hear it in the budgets and appropriations, that we have case ratios that are too high for the managers of these children, that we have PINs that are unhired and positions that are not filled in the local departments, that we have subcontractor issues in the different local jurisdictions and different allegations of fraud with the subcontractors that local jurisdictions are using, that we do have a significant systemic problem in delivering services to the very vulnerable in our population, the newborns and the foster care. And that given the culmination of all of the recent budgets that we have seen here in the joint audit, and given what we have heard in the budget hearings with respect to case ratios and staffing, that in a monitor, we have federal money. We know the governor has some of the federal money left. We know this is a population that suffered greater than others during COVID with respect to child abuse, neglect, and care, that the governor immediately used that money and put a monitor in place to make sure that CJAMS is providing the information that it needs, that CJAMS is functioning in all these departments, that the review of the 24 local jurisdictions is done. They each have different deficiencies, different needs, and different outcomes based on the appendices we've seen in this report. Some jurisdictions have more significant problems than others that I have to believe stem more from documentation deficiencies and more from systemic problems. And because of the population, Madam Chair, and because I know the governor and all of us care about this dearly, that he immediately sent a monitor in to help this secretary and her department do the evaluation and the changes that we need rather than wait for continued audit findings. Thank you.
Delegate Chair Lamb, you want to?
Thank you, Senator Zucker.
Thank you very much, Mr. Chairman. First, I was touched by Auditor Hook's comments about sort of our frontline providers who are dedicated state employees who are doing their best under difficult situations, especially given today's environment. So I guess I have just a few questions. One is there a provider shortage? And if so, how many employees would have been hired? How many providers would have been hired by the $4.8 million that was misallocated?
Ms. Farr, did you want to answer that question?
I'm sorry. Can you repeat that?
Sure. So one, I wanted to salute the state employees that Auditor Hook flagged that are providers that are working under extraordinary circumstances and taking care of a very important population. My question is there a provider shortage? And if so, how many providers would have been hired from the $4.8 million that was misallocated for overpayments?
And so for clarity, when you mean provider, you're speaking of our staff that are our frontline staff?
Yeah, or those, right now there were a number of providers that were overpaid, right? So those same type of providers that were overpaid, theoretically speaking, there are positions that are open to hire more providers like those. So my question is, out of the overpayment of $4.8 million that was misallocated as overpayments, how many additional staff would have been able to be hired with that $4.8 million?
I'm going to defer to Secretary James to respond to that.
Certainly. With regard to the overpayment issue, we have been reviewing that, examining that. We have identified some portion of it in our reviews that we do believe was an overpayment. We have been working with those providers to reclaim those funds. And I also, though, want to clarify the majority of that overpayment is with a single provider. And in many cases, we believe it is an issue of failure to document. And I apologize. I know it sounds like I'm going back to that, but we are carefully going through our Office of Inspector General, working intently through this. There are services that they provided that weren't properly documented and therefore were not included in the calculation of their rates, but were paid for, which results in the appearance of an overpayment. We're working through that to identify what the actual overpayment may be and to recoup those funds. But I don't think that you can necessarily relate A to B. I also want to stress, I've heard the shortage of staff, but the department and the legislative audit Department of Legislative Services has made this case in our budget analysis. The department is meeting the Child Welfare League of America standards for our staffing statewide. Do we sometimes have individual jurisdictions that have challenges? Yes, and we've moved our pins around to adjust to that. Certainly, we've never had a hiring freeze on child welfare workers. That's always been a priority. Even when the governor puts in a hiring freeze, he always exempts out our child welfare workers because we know how critical that is. So our frontline staff are incredible human beings. They do remarkable work that most of us would not be able to sleep at night if we had to do what they did. And we support them 100% and have been working hard to get them the tools that they need to be more effective, more efficient, and so that they can focus on what they care about, which is spending time with the children in our care and making sure we achieve the right outcomes. I don't think there's a direct line between these overpayment issues, which we are working through, and I assure you we will recover those funds if possible, and a suggestion that we have insufficient staff.
Thank you, Delegate Kittleman.
Thank you, Madam Chair. I had many of the same concerns that have been expressed thus far today, but until I read your response and heard your response, I was very impressed by your discussion of the new technology that is now finally into place. And I know that can be critical because I've been in your shoes. Back when Ehrlich was governor, I ran the Maryland Transportation Authority, and we had all kinds of problems with Easy Pass that needed new technology. And that is not something you can simply do. It takes time. And so I hope that will clear up most of the problems. The question that I had, I think you pretty much just responded, but I have had a concern literally since I was in the administration back in the early 2000s that the state does not pay our social work people, I say adequately, but there was a whole huge thing when we went to a $15 minimum wage, that with the limits on what they can get for government, the salaries are not adequate. Are you telling me, though, that you have enough staff that are paid well enough that they can handle their entire caseload, so I can stop worrying about that?
It's a daily challenge. I can say that we have the positions, we have the authority to hire, and we have a very aggressive hiring process for CPS workers. But I can tell you when I feel that I'm there, that I have all the workers that I need, number retire, a number go to a neighboring state. So that's my daily struggle, that I wish I could say, yes, I don't have vacancies, I have all my pins filled, and I have all the staff that I need, because it's always that fine balance that I'm working with. Now, the opportunity that the pandemic, and I need to say an opportunity, the pandemic, right, to allows from a different way of doing the work and the flexibility for workers to do the work. I'm hoping that allows workers to consider staying with us longer and not be burned out as they are, because this job is so difficult to do. It's the most difficult job, I think, that there is, right? That allows some of that to be considered and for workers to stay with us. In addition, the training that we have enhanced, and also us working with universities in the state to help us recruit from recent graduates. That is, all those efforts would get us to that right number. Now, the Child Welfare League does have ratios, numbers by when a state is considered meeting standards, caseload standards. And Maryland has met and is meeting that number.
Thank you. I'm glad to hear that.
You're welcome. And thank you for, sharing what you went through with EC Pass and relating how difficult it is to really make significant change when you have an audience that wants to change overnight, right? And I understand, because we're talking about human beings, right? But unfortunately, it's not an overnight, because you know what? It wasn't an overnight. The issue did not take place overnight. It was throughout many years, right? That's why we're here. So the solution is not going to be overnight either.
Exactly. Thank you.
I'll get it.
Sure.
Crim, go ahead. Doug Harrison.
Thank you. Just two quick questions. When the child, is required to have the exams, either the physical exam or the dental exam, within a timely manner, who's responsible for reporting that back? Is it the DSS investigator who has to go to the home to get that information? Is it the foster care parent or group home provider that is supposed to send the information in? Or is it the doctor who sends it back to DSS? How does that work?
Excellent question, Senator. I'm going to have my director address that. She's been working with the medical director very closely on this exact issue.
Absolutely. Thank you so much for the question. So it is a process, right? You have a youth that's in our care, that's with a resource parent. There's a partnership that we have with the local department staff, the social worker, and the resource parent. And the resource parent obviously is also engaged with the medical practitioner. And so if the child is being seen by a medical practitioner, we receive the documentation from the medical practitioner, and that documentation is then provided in the system, in our system record. And so that has been, again, the key, documentation and ensuring that we are getting the information from the medical practitioner and that information is then placed to our system of record.
So then what you're saying, so based on the findings, these children are not documented as having been seen. So then are you saying, based on your example there or your explanation, that the doctor is not providing the information, or is it that the children are actually not being seen?
What I'm saying is that the doctor would be providing the documentation that the medical examination has occurred, and that information is provided either to the resource parent or to the social worker that may be assisting with the transportation and the support of that medical examination. But either way, the documentation is received from the medical practitioner and it is provided to the local department, and that information should be provided and documented in our system of record.
Okay, so then, so I'm going to deduce then, based on that explanation, that these children are not actually getting to the doctor and to the dentist. Because I don't believe that the medical professional is not providing the information as is required. My next question then is, I think it was finding number 3, the allegations of abuse, whatever that abuse may be, or neglect. You said in your report or in your document that that this would be taken care of, or anticipate the review to be completed by September the 30th, as it related to the 144 children. At what point then, after that review is completed, will you provide that information back to legislative audits?
I don't believe that we are required to provide the information back, but I'm going to ask my auditor.
No, we're not required.
We're not required to provide that information back. when they come back, I'm sure that they would look to validate us completing that review.
Well, with that, then my final comment was actually going to be to ditto Delegate Valentino Smith's request that we do an immediate follow-up, because we're talking about children, and in my opinion, that just is not acceptable. That just because you're not required, you won't send that information in. We're talking about the lives of children here. I'm not as concerned about the money, although that is a big thing. I'm more concerned about the children and making sure that they have what it is that they need to make sure that they're not in another situation in the foster care or the group home that is just as dangerous as where they were with the parent who may not have been prepared to take care of them properly. So I'm just going to ditto Delegate Valentino Smith's request in that we do an immediate follow-up on this, because we're talking about the lives of children here. And I do appreciate the work, and I can only imagine how tough it is on those social workers, the heartstrings and the things that they must witness. But I'll tell you, it must be just as equally difficult for the children who are in those situations. They're already in a challenging situation. They can't fight for themselves. And it's our responsibility to make sure, to the best of our ability, that we're fighting for them so that they have at least a chance at life, a good chance at life. So with that, thank you very much.
Thank you, Delegate Harrison. We're going to go next to Senator Eckert, and then a very brief follow-up from Senator McCray at the end. Senator Eckert.
Thank you very much, committee and Madam Secretary and team. I just want to make sure I heard something correctly. Did I hear that all of these discrepancies were noted in an audit somewhere in the fall of 2019? Is that correct?
Yes.
Okay. And did I also hear you say that CJAMS, the new computer system that you'd been looking for, that had more broader applications to correct all of the deficiencies that were identified in 2017, would have been a different take on it had that snapshot been taken in 2020 when it was implemented? And what I'm hearing here is a disconnect, because I'm hearing we took the snapshot in 2019 when there really wasn't a significant difference in the 2017 report, because those inadequacies in that system were still present. But had that snapshot been taken in any part of 2020, we would have a different report that we were looking at today. Is that your understanding, or did I have time warp here?
No, that's exactly what I said.
So is it fair to say in some ways you had anticipated CJAMS being implemented a lot quicker than it was? In fact, then it was not implemented, so that your reporting was not anywhere improved from the 2017 audit. But if we went back tomorrow and did that snapshot, we probably would get a totally different picture. Is that correct?
Correct. I feel like the auditors, to put it in plain English, came back a bit too soon, because I was not finished with what I had said was going to address and remedy the finding.
Okay. I just want to make that, that just kind of stuck out like a sore thumb to me. So I wanted to make sure what I heard was accurate. So thank you very much, because I know we have really struggled through the years with getting accurate documentation, and then not only getting the accurate documentation, but making sure that all the staff were fully oriented and proficient in being able to enter that data in a different way than they had been entering it with Chessie. Is that accurate or not a good conclusion?
Yes, absolutely accurate. Absolutely accurate. Now, I do want to offer a clarification that I believe my Deputy Secretary just pointed out. Right,
just that the 2019 was not it was a periodic review that OLA undertook during the life cycle of the prior audit. So it was not we did not have an additional, there's not a third audit in the mix. It's just that there was the 2017, they came back to 2019, at which point they noted most of these things were in progress. To the extent that they gave us feedback and suggestions for improvement, we did work to implement those as well. But as you said, a number of a lot of the solution to this on getting a new data system in place so that we could effectively monitor, and rather than investing a lot of money into a data system we knew was going to be turned off in a number of months.
Yeah, and a new system in place along with the change in processes that was taking place, because we were doing both parallel. We would change the policy and we were also changing the system. So together could really build that new child welfare system that is very much needed. Thank you.
Thank you. I know Senator McCray, a quick follow-up, and I just saw Senator Hester's hand come up too. So Senator McCray first.
Thank you, Mr. Chair, and thank you for letting me get the second question in. Madam Secretary, when I hear your responses on newborn, the newborns that was families were terminated in reference to having control or in reference to their having access. When we looked at the newborn piece of it, and we looked at 2019 and you all's response, it sounds very similar to the responses that you're giving here today. You talk about a policy analyst and hiring, and you talk about the director and reviewing, but the response that you gave in 2019, and it says that you were implementing it in May 18, says, identify an alternate CPS family preservation staff person to correspond with local departments. May 2018 instituted a weekly and monthly supervisory review of the status of the birth matches. Additional steps are being added during the summer of 2018 to improve the birth match process. Also forwarding, and it talks about the assessment. It also talks about an email address. These are very similar responses that you gave here today. I know that you stated that you needed more time to get that number down from 144 to 200 that were identified that weren't documented. So my question is, the local departments cannot do their job without your help. So they can't until you send them the information. So how long will it take you all to efficiently operate the birth match process? It was 3.5 years ago when you gave that response. Will it take another 3.5 years to make sure that it's efficient?
Thank you, Senator. And the fact that my response is similar, it further validates what I've been saying throughout this hearing, that I'm not changing what I have intended to do. I just want to finish what I intended to do. And what you have in front of you is a report that is a bit too soon because I haven't finished what I had said I was going to do. But regarding to the birth match, I'm going to ask, I have two people that I would like to elaborate on this. I'm going to first have the SSA director, but then I would like for Brandy Stockdale, who is on the phone and works very closely with the birth match in Baltimore City, to also offer a bit of the response. Very short because we're short in time.
Yes, so yes. Thank you for your question. That, I have to be very honest with you, was also a concern for me because we apparently did not make the best selection in our choice of the individual that was required to do the work. We had to reset if I can be transparent, we had to reset, and in our resetting, and I appreciate the Secretary's support, because moving forward now, we have better traction, and I have more confidence, if you will, in terms of making sure that this happens. And you're absolutely correct. The locals cannot do their job if we're not able to support them. And I really do believe the multi-tier process that we have in place and the individual that we have now responsible for this work is going to ensure that it's carried out.
Randy, could you?
Thank you.
I'm sorry. Chairman, back to you.
Thank you. Senator Hester?
Thank you, Mr. Chairman. There's a lot to unpack in this audit report and hearing. I wanted to ask a follow-up question on the data management system, and I doubt anybody will be able to answer it today. So if we could follow up in writing, that would be excellent. But my question is, the shift from the one data management to the second system, what was the strategy and timeline for that shift? And then how did we get off track and or delayed? The second question is, were you working with the Department of Information Technology? The third question is, who was the contractor charged with implementing the system, and how were they held to account for the, for the time delay, and how much did this cost? So very technical data questions. If somebody could just get back to me or to the staff of the committee, that would be great. Thank you so much.
Senator, if I may say that we can answer your questions today. So I'm going to have my Deputy Secretary for Operations to answer that question.
Sure. Thank you, Madam Secretary. So the CGM system was part of MD Think, and the original MD Think project was approved for funding from our federal partners and the General Assembly. Thank you very much. In 2017. So the average time to implement a child welfare data system is, in almost any state across the country, is 5 to 10 years. We had a very aggressive timeline of having this done in about 2 years. That proved to be overly aggressive. We did complete full implementation in July 2020. Some of that was just because child welfare is an incredibly complex process. And so making sure that all of the workflows, all of the documentation, all of the approvals worked consistently across the system, making sure that our system could support 24 different local departments and the different ways that they did business was a complex and challenging process. So I'm very happy to say that with the help of our local departments, we ran an extensive field test in Washington County for several weeks and months to iron out issues. That system was rolled out and was deployed statewide in July 2020, which is approximately 1 year later than we had originally planned for deployment. But I think by any national standard, that's a remarkable achievement, 3 years to deploy a child welfare data system. And I can follow up with the cost and the vendor information for you. But as part of MD Think, much of this was done by a state team. We did not, for MD Think, we did not use an integrator. The state managed this project. We did work very, very closely with Do It. They are partners on this. They, as you may have seen in recent executive order for MD Think, they're part of that governor sub-cabinet, the MD Think project, as well as our partners at Department of Health. And one of our new partners on MD Think is the Bureau of Vital Statistics, which is where we get the birth information for us to do the sends and the birth match. Having them on the MD Think platform allows us to better exchange information and should make that process move much more smoothly than it has in the past.
Thank you. I think that wraps up the questioning for this part of the hearing. I know there were a lot of questions and interest in this, and appreciate all of your responses and also the time of the auditors.
One other thing, Chairman Lamb and I have talked about this. we'd like to do a follow-up with the department this fall before session starts. Because you have represented here today that you have now implemented this new system, and you believe that these findings will be resolved by implementing this new system. So we'd like to follow up on that and to make sure, just because we're just very concerned about these vulnerable children. So the staff, the audit staff will be in touch. And so with that, we thank you very much for your time today, Madam Secretary, and your staff and your patience. And we look forward to more discussions with you as we resolve this issue. Chair Lamb, do you have anything to say further on this?
No, I think that echoes my thoughts too. Thank you,
Okay.
Chairman Karim.
Okay, thank you, Secretary Padilla. Auditor Hook. I think we're finally ready to go on to the judiciary. So
Thank you, Madam Chair. I want to make one statement. I won't belabor the point, but I hope and pray that this computer system is the cure-all and end-all. However, a lot of our findings were procedural related and how they used the existing system. So the systems themselves aren't the solution. It's how you utilize the system and how you interact with your manual processes and your policies and procedures. So, the next audit, I guess we'll figure out if it worked or not. In God we trust and everybody else we audit. I would like to apologize to the committee and to the chief judge and her staff for how the timing of this hearing is playing out. I had assured the co-chairs that we could comfortably fit 2 audits into this 2-hour hearing. And clearly, I did not accurately predict the extent of the committee's interest in the SSA audit report. So I made a mistake, which is something else you don't hear an auditor say very often. The second report to be presented is the April 7th, 2021 audit of the Maryland Judiciary. This audit included the courts and various other agencies, such as the Administrative Office of the Courts and the State Law Library, that support the administration and regulatory functions of the judicial branch of government. The report contains 7 findings. I'm speaking very quickly, by the way, with 2 of the 5 previous report findings related to judiciary operations repeated. I think it's a fair assessment to say the judiciary generally agreed with the factual basis of our findings, but initially had questioned the necessity or usefulness of some of the recommendations. From reviewing the testimony submitted by the judiciary in advance of this hearing, it appears that further agreement on most issues has now been obtained. Although we had findings in 5 different areas, procurement-related issues were the subject of 4 report items. By way of background, as an independent branch of state government, the judiciary is not subject to the requirements of the State Finance and Procurement Article of the Annotated Code of Maryland or state procurement regulations. Rather, the judiciary has established a procurement policy under the authority of the Chief Judge of the Court of Appeals in accordance with the Maryland Constitution, and this policy is basically intended to foster effective, broad-based competitive procurements. The aforementioned 4 findings dealt with adequately securing contract proposals and bids, retaining certain documentation of the bid evaluation processes and award decisions, and publishing awards of all contracts on eMaryland Marketplace or its replacement. We also concluded that judiciary did not consider the use of available statewide contracts, resulting in reduced competition and increased costs for consumers. These issues and others speak to the need for enhanced accountability and transparency in the procurement process. We also received a referral to our fraud, waste, and abuse hotline on a procurement-related matter, and a review of a master contract for information technology, cable, and wiring disclosed a lack of accurate and comprehensive records documenting project awards and costs. And we concluded that judiciary did not properly award task orders and change orders, certain of which appeared questionable. Certain of these matters we did refer to the Office of the Attorney General's Criminal Division, but I should add that a referral does not imply guilt or any other such conclusion. It's simply a referral. I will now turn it over to the Assistant Audit Director, Matt Street, to present the highlights of the findings and in the essence of time, and he'll be assisted by Audit Manager Bakana Adosa and Senior Auditor Sandy Medeiros and Joe McWilliams. Matt, can you please take it away?
Thank you, Greg. Good afternoon, ladies and gentlemen of the committee. And as Greg mentioned, in interest of time, I'll keep my comments as brief as possible. I'll first discuss the procurement-related findings and then discuss the findings regarding eligibility determinations for legal representation by a public defender. On page 3 of our presentation, there is a summary of these findings. The first finding I will discuss involves the judiciary not adequately securing or retaining critical procurement documents, as well as publishing contracts as required on the state's online procurement portal known as eMaryland Marketplace Advantage. This is found on page 5 of our presentation, and it's finding 1 in our report. So based on our test of 10 contracts totaling $36 million, we determined a couple things. First, although the bids were kept in the procurement office prior to bid opening, they were maintained in a manner that allowed access to any party gaining admittance to that office. The procurement policy specifically requires that the bids and procurement documents are to be retained in a secure place until the established due date for bid submission. Second, the judiciary's procurement policy for retaining critical bid documentation was not as comprehensive as state law. Specifically, the judiciary only retained bid documents until the expiration of the period of time for losing bidders to protest a contract award. However, state law expressly prohibits the destruction of any records that relate to a financial operation of a unit of state government until the audit requirements are met by our office, which in the judiciary's case is a 4-year audit cycle. As a result, the judiciary did not maintain the critical losing bidders documents, including financial and technical proposals or selection committee evaluations for 3 contracts totaling $7.3 million. Third, the judiciary did not document a $2 million intergovernmental cooperative purchasing agreements for office furniture to determine if it was competitively procured and it resulted in favorable pricing and conditions to the judiciary. Intergovernmental cooperative purchasing agreements are basically mean that the state agencies are using another governmental agency's contract. This could be a federal, state, or local entity to purchase goods and services rather than procuring its own contracts. And the agreements can be beneficial since they streamline the procurement process, but state agencies should still be making sure that the contracts are procured in a manner that obtains favorable pricing for their agency. Finally, although the judiciary advised us that it posted contract awards on its public website, it did not publish those solicitations and awards on the state's online procurement portal known as eMaryland Marketplace Advantage. This was for 8 contracts totaling $34.6 million. Publishing awards on the eMaryland Marketplace Advantage provides a potentially greater reach for the vendor community and improved transparency over state procurements, including information about winning bidders and the amount of the awards. I will now discuss finding 2 of the report, which is detailed on page 6 of the presentation. We reviewed the judiciary's contract for processing credit card transactions. This was a big contract. It's both for online and in-person district court transactions. We determined that the same vendor had been used on this contract since at least 1989 through sole source procurement methods, even though there's vendors out there that can offer these services. So in fact, during our audit, we determined that a statewide contract for similar credit card processing services was available at a seemingly lower cost to the customers and consumers. At the time of our audit, the judiciary's contract provided for the vendor to charge a flat fee of $6.95 per transaction. These transactions are typically, paying a traffic fine or a related court fee. Conversely, the statewide contract had a 3% charge for each transaction. And we did an analysis of comparison based on the transaction history. And we estimated that consumers would have saved $2.7 million during the period from December 2015 to June 2019 under the statewide contract if it had been used. Now, subsequently, through negotiations between the judiciary and its vendor, the flat fee was reduced by $1 to $5.95 per transaction. So it remains to be seen if that's still a more advantageous price or not than the statewide contract. I will now discuss 2 findings involving a review of an allegation we received through our fraud, waste, and abuse hotline regarding questionable contract activities. The allegation involves certain judiciary employees and a vendor performing work under the information systems cabling and wiring master contract. at the judiciary's offices and courthouses. This is on page 7 of the presentation. And page 7 has a summary of the allegation. Page 8 of the presentation has a summary of the task orders we tested from the master contract. Now, the contract was procured in 2014. It was awarded on a 3-year term at $2.5 million. It went to 9 vendors that could bid on the different task orders being offered. And the contract included 7 one-year renewal options. Judiciary management had advised us that it received a similar allegation regarding the contract. And in fact, its internal affairs division, and in conjunction with its internal audit department, performed an extensive review of the allegation. The review that they did included interviews with employees and reviewing procurement and invoice payment documentation. Both of the internal affairs division and the internal audit department issued reports with recommended actions for the judiciary to implement. As noted on page 8 of the presentation, as of June 2019, the judiciary awarded the vendor in the allegation 123 of the 193 task orders. This accounted for, the value of those task orders accounted for about 73% of all work awarded. We tested 6 of the task orders awarded to the vendor, totaling $802,600, which included change orders totaling $142,900. The combined value of the change orders represented a 22% increase from the original amount of the task orders that we tested. Page 9 of our presentation details the findings of the 6 task orders that we tested. For example, we determined that accurate and comprehensive records of the project awards and costs were not maintained. As a result, we noted that the judiciary overspent the contract by $664,000 and overcommitted its task orders by $769,000. We also saw that bids on 2 task orders were received, after the specified due dates in the solicitation, and the reasonableness of most of those change orders that occurred were not assessed. I will now discuss finding 4 regarding the judiciary not taking sufficient action to address the recommendations noted by its internal affairs division and internal audit report. Page 10 of our you can see that on page 10 of our presentation, which at the time of our review, 3 of the 6 recommendations from its internal audit report had not been implemented. These recommendations included establishing dollar thresholds for obtaining approvals on projects, procedures for recording change orders, and procedures for authorizing the start of work on the task orders. I will now move on to discussing the eligibility determination for obtaining a public defender. This is on page 11 of the presentation, and it's finding 6 in our audit report. As just a way of background, state law transferred this responsibility to the judiciary for most public Office of the Public Defender services effective October 1st, 2017. The Public Defender's Office retained responsibility for determining eligibility for certain proceedings, such as juvenile proceedings and involuntary commitments to public and private institutions. As of June 2019, the judiciary had made 191,000 eligibility determinations since it assumed the responsibility. Our audit found that the judiciary had not developed a formal policy and definitions for determining an applicant's household or family size as required by federal regulations, and it did not obtain documentation to verify the household and family size claimed by the applicant. We also noted that the applicant information entered into its database was not reviewed, at least on a test basis, to ensure that the accuracy of the data was in place. Page 12 of our presentation includes a summary of 2 other report findings dealing with controls over the judiciary's traffic processing center and its handling of equipment. The finding regarding the handling of equipment was repeated from our prior report, and we also had similar issues regarding judiciary's controls over equipment, which have been commented in audit reports dating back to August 2010. Page 13 of the presentation includes some of our recommended actions to address the findings. This concludes my presentation. My team and I will be happy to answer any questions that you might have.
Thank you, Matt. Does the committee have any questions for Matt before we go to Chief Judge Barbera? Okay, I see no questions. So Chief Judge, where are you on my screen? Oh, there you are. I see you down there. How are you?
I'm very well. Thank you. Thank you, Madam Chair. I'm happy to be here this afternoon. I can just imagine the amount of work and mental energy that goes into hearings of this sort. I listened to the prior and learned quite a bit. To begin with the official language that I always begin with, Senator Chair Lamb, House Chair Krim, and distinguished committee members. Good afternoon, and thank you for the opportunity to comment on the Office of Legislative Audit's recent audit report of the judiciary. For the record, I am Mary Ellen Barbera, Chief Judge of the Court of Appeals, and with me today are John P. Morrissey, who is our Chief Judge of the District Court of Maryland, and Pamela Harris, our State Court Administrator. In the interest of time, I will keep my testimony very brief. And I begin with the following. I would like to express on behalf of the judiciary, our thanks to Mr. Hook and the members of the Audit Committee for the careful and thorough work and analysis performed over these many months. Thank you. I will note that although the judiciary disagrees with many of the factual findings in the audit report, we have, I'm happy to report, either already implemented or are implementing changes that will address those findings of concern. In fact, items 1 through 5 have been addressed in full. As such, we hope you will agree that these matters are moot and should not require further discussion. However, I have with me, as I've mentioned at the outset, Ms. Harris and other staff available to address any lingering questions that you may have. So with that and your permission, I would like to turn things over to Chief Judge Morrissey, who will address items 6 and 7.
Thank you. Chief Judge Morrissey.
Thank you, Madam Chair. Chair Lamb, Chair Krim, members of the committee, good afternoon. For the record, my name is John Morrissey, and I'm the Chief Judge of the District Court of Maryland. I thank you for allowing us to present this afternoon, and I'd like to thank the Office of Legislative Audits for their thorough work during this audit. In some of the meetings and correspondence that was exchanged leading up to this meeting today, or this hearing rather, it appeared that OLA was concerned over the disagreement the district court had specifically with finding number 6. That finding involved the eligibility determinations for the public defender representation that previously had been housed, and in my opinion, correctly so, in the public defender's office, but was transferred to the judiciary effective October 1st, 2017. As you can see from the numbers of the presenters from OLA, this is a massive undertaking that involves qualifying or not approximately 100,000 defendants for public defender representation each year. The commissioners who are statutorily required to run this program are judicial officers in much the same way as I am a judicial officer. Any judge is a judicial officer. In developing this program, we adhered strictly to the authorizing statute, which I will speak to more in just a moment. OLA had 3 issues in finding 6. The first was that we did not have a definition of family household. And if you could go to slide 3, please. We agreed we should have had that family household definition, and I almost immediately approved the definition, and the commissioners then were trained on the definition, and it's used daily now with all the defendants to elicit their response to that question. The second issue in finding 6 was that there was no review of the correctness of applicant information being input into the system. And while we believe that there was a process in place at the time of the audit whereby the commissioners were verifying all documents being scanned into the system, we nonetheless agreed with the OLA recommendation and formalized the review system in 2 ways. As of August 4th of this year, 2021, we have programming added to the database that will document 100% verification of the scanning of documents into the database, as well as a 5% administrative review of the decisions made by the commissioners for correctness. The sticking point between OLA and the court lies in adherence to the controlling statute, as well as the role of judicial officers investigating defendants that come before them. As to the statute, the defendant must submit the application under oath or affirmation with the penalties of perjury attaching. If you could just go to the next slide, please. Further, the statute provides that the DLLR database and the Comptroller's Office database may be accessed in the application process. And in fact, the commissioners use these databases and always have on each and every application since October 1 of 2017. In fact, we had quite a procedure to try to get DLLR and the Comptroller's Office to open up their database to us, but we use them in every single application that's to verify income and prior employment. However, the statute does not require the commissioners to investigate the correctness of every application. If you could go to the next slide, please. In fact, the statute explicitly provides that such a review be conducted only when the circumstances warrant. The problem that we have is that in our justice system here in Maryland and across the United States, judicial officers do not act as investigative tribunals. I cannot, as a judge, or if I was a commissioner, do independent research on a case or individual to determine whether that person is being truthful. Rather, such an examination is determined by the adversarial system. Someone has to bring it to our attention to investigate whether the applicant was being dishonest and to present those facts to the judicial officer for determination. It's not a separation of power issues as OLA seems to suggest, but rather the basic functioning of the court system. We cannot and should not be an investigative tribunal. It's one of the reasons why I thought it was properly housed in the public defender's office and not with the commissioners, but that's what the statute requires us to do. I want to assure this committee that I do not take lightly disagreeing with OLA and would not do so in this instance unless it was such a core principle of the court system. I hope this explains the issue to the committee as to why we were somewhat stubborn on agreeing as to finding number 6. As to finding number 7, as the chief had said, 1 through 5, we've already got. As to finding number 7, a new integrated fixed asset inventory system will go live in October of this year. And this should remedy all of the issues raised in finding number 7. We've been waiting for this for a little while, and it's part of the reason why there was a delay in our completing the audits, and we will, our inventory rather, and we will have that in effect starting in October. I'd be happy to answer any other questions you may have with respect to finding 6 or 7, or if you have any other specific questions as to other audit findings, myself or others here in this room will be happy to address these issues. Thank you.
Thank you, Judge Marcy and Chief Judge Barbera. And I admire you so much, Chief Judge, and also you, Judge Marcy. But I also have to stick up for my auditors here, and you know they.
Oh no.
Chairman Krim, you may have been frozen. Are you still there?
I was on her side.
Doug Krim?
Just when she was sticking up for the auditors too.
No.
We can skip that part if you'd like.
Well, while we wait for Chairman Krim to come back on, I'm actually going to, I guess maybe there's some separation here, but, I am concerned about finding 6, but my concern really lies with making sure that people do get, defendants do get adequate representation when they need it. I think my perspective on this is that most folks don't choose willingly to go through the route of the services of a public defender if they have other means or options to be able to find representation. And, I understand the need to thread the needle here for us to, ensure that those who really need a public defender services have that ability to go ahead and do so, and to ensure that those who use those services are qualified. But I also want to make sure that those who don't have any other means to have representation, which is required by law, that we are adhering to the responsibility of providing them that service. And so, I guess based on what you'd presented, Judge Morrissey, I think what you had shown us was that the statute does not require the commissioners to actually validate household size or investigate financial status of the applicant, and that verification in some ways is really contrary to what's explicitly stated in the statute. Is that the proper interpretation of what you conveyed to us?
Senator, that's precisely it. I think the intent of the legislation was that these happen at the initial appearance stage, which can happen at midnight or 1 o'clock in the morning, and people that are arrested don't have documentation on them typically of what a household size is or any verification of income. The use of the DLLR database and the Comptroller's Office database does give us the ability to look back, albeit it's some time in the past, but it does give us some ability to verify whether the individual in the statements that they've given us is telling us the truth or not. But to affirmatively go out and to try to investigate the individuals is not authorized in the statute, and it's contrary to what, as a judicial officer, we're supposed to be doing. We're not supposed to do that.
Got it. So while it may be suggested practice or kind of just good housekeeping, it's not actually required by the statute based on what the legislative branch had passed, I guess, into law. Have you come across? Go ahead. Sorry,
where circumstances warrant, some of the individuals that come before the commissioners have obviously been arrested in the past, and the commissioners will look back, and if their answers are different, then they would have the ability then to look further into whether the person is, if they say that they're making all sorts of money before, they can challenge that individual and determine whether or not they lost their job or some circumstances changed for further questions in the process of approving the application.
Mm-hmm. Have you come across or been made aware of any circumstance where a defendant was misrepresenting their financial status or household size? And if so, how often would you say that's the case?
I have on the line with me the director of the commissioners. I personally am not aware of any instance of that occurring, and I would defer to Tim Haven, who's the director of the commissioners, if he can answer that question.
I can answer that question, Mr. Chair. We have a system set up with the public defender's office that if they, because normally we won't see it, but if they see somebody comes to their office to ask for their services, and they have a question about that, about their qualification, they will contact me directly, and I will do whatever I can to try to figure out whether what that person has provided is true or not. One of the issues that we have is that the comptroller information is basically whatever your taxable income was last year, the last time you filed, and then DLLR only provides information from the last quarter. If you had a job, or if that job was, if it wasn't with the federal government or you weren't self-employed. So a lot of times we'll get information that is old. So if you had a job 3 months ago that was paying you $10,000, a month, but this month you got fired and you no longer work at that job, where there's no way for us to verify that. So in those, there's been 2 cases since 2017 that the public defenders come back to me. One individual was living in a $1 million home. And I was able to determine that home was actually rented, and his rent was way more than what his income was based on everything I could figure out. So those were 2 cases that the public defender brought it to my attention, and then I did a little bit more research into it. I still can't go to their house, but I was able to find out who owns the home and find out, if there was a mortgage and things like that, just through our usual processes.
Thank you, Mr. Haven. Just for sense of scale, that's 2 cases out of how many?
Well, luckily, I brought my stats up, so I figure I might have to answer that question. We've accepted 546,000 applications for the public defender in the last 3 years, or 4 years, 5 years now, I guess. So so there's 500,000, and those have been 2 cases that have come back to me. Now, if there's others out there that the public defender did not question, I can't really answer that. But if there's any question on that application, so at the initial appearance, we'll do a provisional, and then if the commissioner can't verify, or at least there's a question about what happens when they look up DLLR and the information comes back and doesn't quite mesh, even if they're working for the same company, but they claim they're making less than what DLLR will say, we will request documents from them that, just show me a pay stub or something like that that says what you told me is the truth. So everything isn't purely on the spot. We will ask for documentation if there's a question.
Senator, may I just chime in?
Yeah, go ahead, Mr. Hook.
I will concede the Chief Judge's point, and I also concede your point that we don't know the impact of this. It's a theory. You call it a good housekeeping or housekeeping recommendation. It is a theoretical recommendation to establish accountability, and I do not know the extent of the problem. I mean, you mentioned 500,000, and it could be 6 out of 500,000. If they had done this verification, it could have been 100. It's probably not going to be a lot. I will say that. And all we did is we make the recommendation. It was a repeat finding from the public defender's office, and we bring it to your attention. And if the committee would rather err on the side of just making sure that, if you want to make sure people get a public defender, and if a couple people slip through the cracks, and it could just be a couple people, that's okay. I mean, we look to the committee for guidance on this, and we can actually, we can drop this next time if the committee does not think this is a significant problem. And honestly, I can't say if it's a significant problem because it's theoretical.
Thank you, Mr. Hook. Yes. I see, I think Chairman Krim is back with us, and so I'll turn it over to her.
Oh, thank you, Chair Lamb. Are there any other questions from the committee? Geraldine, did you say? Okay. Delegate Valentina Smith.
Thank you, and thank you, Chief Judge. And in the essence of time, I'll just ask a question for you to maybe submit back to us. So I appreciate in your response that the judiciary is an independent branch of state government, and that the statement is it's not subject to state finance and procurement article, but that the judiciary has a procurement policy established under your guidelines. And so if you could send to us, because we do at least try to develop a certain sense of, in the state procurement article, commitment to minority contracting and prevailing wage and things like that. If you could just send us, you don't have to go over it now, what the guidelines that you've established are for those parameters, it will at least just give us a better understanding of how your process parallels with ours, notwithstanding the fact that it is completely independent.
We'll be happy to do that. We'll send that to you this afternoon.
Thank you.
Thank you. Delegate Harrison.
Thank you. So my questions were really, I know that you said that you addressed findings 1 through 5, but and finding 2 and finding 3, finding 2 being the sole source contract that has been in place since 1989. Let me ask, who then is responsible for your contracting? Do you have a procurement? I guess you have a procurement department, and the person who's the head of that, is it the same person who's been there since 1989?
No, we have our director of procurement here with us right now, Mr. Mays, Daniel Mays. He is with us right now. He is new to the judiciary. We have had a number of directors since that time, however.
And in response, Delegate, I would make the decision is that this is you're sitting mixed between district court headquarters staff and AOC, Administrative Office of the Court staff right now, but we work together very closely. So the district court uses the procurement office of the Administrative Office of the Courts, but it would fall to my decision as to, because this was a purely district court program with that sole source contract, it falls to my responsibility on that.
And you didn't see a need to consider another company since 1989? We're talking almost 30 years.
And I'll defer to my director of operations that's here, but it's more complicated than it probably should be, but it is because they provide us an extensive suite of services that intermixes with all of our other systems, and they provide us all the equipment. It's kind of a turnkey product that's specific to us, that provides a very good service, including, you know, reports and things like that to us. Ms. Harris and I have discussed about a more robust system in light of, you know, being able to swipe on a square at a grocery store or even a stand outside, and whether we can incorporate the advances on that the next time this contract comes up.
So then that would be separate and apart from this particular contract?
No, it would include this contract. I mean, we would certainly review it to see whether this contract is going to stay or whether we could go to a more robust system.
I'm sorry, I meant vendor. I meant to reference that as the vendor.
The vendor's very competent in what they do, and we're very satisfied with the product that we had, and we did negotiate a price reduction with them. Whether there are other services out there that can provide equal or better services, we're going to explore, is what I'm telling you.
Okay. And then as it relates to finding 3, and then I guess it's the associated finding 4 with the change orders. Was that a sole source contract?
Thank you for the question. Good afternoon. For the record, my name is Daniel Mays. I'm the Director of Procurement, Contract, and Grant Administration here at the Judiciary. No, that was not a sole source contract. That was a master contract that was solicited by the Judiciary for cabling and wiring. As we submitted in our written testimony, that contract is actually now expired. And kind of building off of the OLA recommendation in finding 2, we took a look at the statewide contract that exists for cabling and wiring and have determined that that meets our business needs. So moving forward, we are actually looking at leveraging the existing statewide cabling and wiring contract for our needs.
And then I would assume that these are not minority contractors?
There are several minority contractors awarded under the master contract.
Okay. All right. Thank you.
Yes, ma'am.
Back over to you, Chair Lamb. I think you have 2
next
senators there.
Senator Kramer.
Thank you for that, Mr. Chair. And what I'm going to offer is not a question, but I'm going to take this opportunity to give my heartfelt thanks to Chief Judge Barbera for her many decades of outstanding public service to the people of the state of Maryland. She has been exceptional in her many years. I think this points directly to the fact that this artificial cap of somehow age 70, very talented and energetic people are mandated to retire, and we then lose the benefit of their services going forward, which is a real shame. But I just wanted to take this moment and this opportunity again to offer my thanks to the Chief Judge for her significant and outstanding public service. So thank you for that, Mr. Chair. And Chief Judge Barbera, I wish you the very best in whatever the future brings to you, ma'am.
Thank you. I think we all echo those remarks, Senator Kramer. Last word from Senator McCray.
Thank you, Chairman Lamb, and thank you, Madam Chair. Senator Kramer took my thunder. I was going to lift up Chief Judge Barbera. It's been a pleasure to be able to work with her, get to know her in her level of service for the state of Maryland. Chief Judge Morrissey, I had like more of a technical question, and I was just curious about this, but I think Delegate Harrison kind of made me even think more about it. But I'm sure that you all have policy and guidelines set around MBE, around procurement. I just want to make sure that I'm not assuming and just get an official response.
We do, Senator, and I'd be happy that our procurement officer will explain.
I appreciate you.
Yeah.
Yes, Senator, we do have guidelines around MBE participation, and we set subcontracting goals where appropriate, as well as aggressively seek out opportunities to solicit MBEs to serve as primes on contracts as well.
Thank you.
Yes, sir.
Okay, I think that's all of our questions on the judiciary. So I think that concludes this audit hearing. Thank you so much, Chief Judge, and I guess we won't be seeing you again. Too bad.
No, but certainly not in this capacity. So I'm pleased that and I'm thinking this is my last appearance before one of our primo legislative committees among the many. And so Senator Kramer, he embarrassed me. But it is a privilege to serve just like each and every one of you. You serve the people of Maryland, and you do a wonderful job at it. I did listen to the entirety of the earlier presentation, and I was very impressed by the questions and the interest that this committee has on so many of the things that we're doing here as we deliver services to the people of Maryland. So with that, thank you. I have a meeting to attend, and I know that my colleagues are always busy. So with that, thank you again for the opportunity to appear before you kind of in person. Bye-bye, everyone. Thank you.
Thank you very much.
The best to you. Thank you.
Thank you, chairs.
Thank you, Judge Rivera.
Okay, so I think then next on our agenda is Mr. Hook, our Chief Auditor, has a report for us. You are muted, Mr.
Apologies. As I said before, computers are not the solution to everything. But anyway, you have the third presentation. You have in your packet is a summary of reports issued and recommended committee action. And this is a list of audit reports issued since the committee last met. In addition, and you can just scroll through this, Liz, and show people. In addition, we recommended 2 reports for a committee hearing, which we just did. And we recommended 3 reports for letters of concern. Those 3 reports are being recommended based on the nature of the respective findings. The first is the Comptroller of the Treasury's Compliance Division. That is being recommended due to the significance of its primary mission and the findings that closely relate to it. The second is Department of Natural Resources. We had 3 findings that related to 2 conservation programs, which we thought were worthy of the committee's intention through a letter of intent. And the final one is the Maryland Department of Health Regulatory Services. This is actually an amalgamation of a number of health-related boards and commissions where we found licensing monitoring issues at certain boards, and where collectively we believe the group, and I say group of boards and commissions, could benefit from some form of shared or pooled support functions. So I would appreciate if the committee could, I guess, take a vote on whether we should send this letter of concerns, but I think these are 3 worthy audit reports for that step.
So do we need a motion here to send the letters? So moved.
Mr. Chairman.
Can we review them?
Okay, all in
Madam
favor?
Chair. Madam
Yes.
Chair.
Yes.
Can I separate out the compliance division and vote on that separately so I can take the rule?
Yes, sir. Mr. Hook, could you just then state what we're voting on? And
The first will be sending 2 letters of concern to Department of Natural Resources and the Maryland Department of Health Regulatory Services regarding those 2 audit reports.
Okay, all in favor?
I haven't had it.
Aye.
Addie, you're muted. What did you say?
Thank you. I just wanted to review those. I've had a little bit of technical difficulty here today, so I'm trying to get those up and review them, scan them.
Okay, so,
Before I vote, I just like to know what
okay.
that's all.
Do you want to briefly explain, Mr. Hook, what they're,
I think, Liz, did the actual audit reports accompany the handouts to the committee members?
The reports did not accompany the handout, and we can send the links out to those reports. But the findings are summarized in the back of the summary report that was included in the back of the packet.
Oh, you're right. Yes, correct. Liz, can you would you mind bringing that up for
Sure.
DNR?
Thank you. Thank you.
Okay, or this one first. This is regulatory services, and this is just a summary. There were 7 findings in the audit report, including 5 repeats. And this simply highlights some of the problems we had. The first bullet, complaint tracking procedures for 2 of the boards, actually Board of Nursing, which is a very large board, disclosed they didn't have sufficient oversight to ensure complaints were investigated timely. Healthcare, second bullet, healthcare quality, did not inspect each of the assisted living facilities and developmental disabilities service providers annually, kind of a big deal. Third, just some controls, internal controls over collections and deposits received at some of the boards were not adequate. And you can see we had issues actually at 19 of the 22 boards and commissions we reviewed. And then the final one is that 21 of the boards and commissions did not perform documented system access reviews of their respective licensing systems to ensure that the capabilities were adequately restricted. I mean, we think these are rather significant findings, and that's why we think we are good for a letter of concern. And then the next one, Liz, if you could do DNR very quickly, Department of Natural Resources. We had 7 findings in this one as well, but only 1 repeat. The findings here, we had 3 findings, and that's what these 3 bullets are regarding 2 conservation programs. The first involved overpaying for land conservation easements. The second, they did not require required documentation needed to monitor the State Forest Conservation Act program, and did not use money collected within the time frame. And then the third was they did not have an effective process to monitor Forest Conservation Act programs to ensure local jurisdictions were operating within the law. Again, not the biggest findings in the world, but certainly these 3 programs are very important to the natural heritage of Maryland. And having just gone out last month and spent a week in Western Maryland hiking in the state forest and parks, I think these are big deals. So one of the reasons I wanted to have a letter of concern for this report.
so are there any questions from the committee on these 2 recommended actions? Okay, I think we're ready to vote then.
I'm sorry, Chairman
Oh,
Krim.
Yes.
I just wanted to ask what a letter of concern sounds like. What does it say?
Liz, you can jump in, but because the letter of concern is actually drafted by committee staff, but the letter of concern highlights some of those issues that you just saw, and asks for the department's follow-up as to what actions they're going to take to ensure they're corrected. And Liz, correct me if I'm wrong. That is pretty much what it is, isn't it?
An accurate summary. It requests that agency to provide a follow-up report to the committee by a certain date, generally about a month's time, reporting on the actions that have been taken to implement their recommendations and what controls and procedures have been put in place.
Okay, thank you.
Okay, Senator Eckert, your hand is up. Do you have a question? Senator Eckert, do you have a question?
No, thank you.
Okay, all right.
Thank you.
All in favor? Aye. Okay.
Aye.
Aye.
So, Mr. Hook, we're going to be voting separately on the compliance.
Yes, Liz, could you bring that up? The Comptroller Maryland Compliance Division There it is. This had 5 findings. It had 3 repeats, and there were 15 pages in the audit report. And the Compliance Division has a very important function, which is the enforcement of all tax laws administered by the Comptroller's Office. And as you can see, what we've done in these 4 bullets, we've highlighted some of these 5 findings. They did not consistently perform 3 of their available tax compliance programs to identify individuals who failed to file required income tax returns. The business tax collection unit did not ensure that tax assessments were prepared and recorded in the SMART system on a timely basis. Did not adequately control critical adjustments to the taxpayer accounts in SMART, and then did not always assess penalties as required by law when holders of unclaimed property failed to remit such property to the division. These were all report items, and each one of these bullets in these various presentations are actually audit report items. So by virtue of being in an audit report, we think they are significant. And certainly the Compliance Division has an important function to play to the state of Maryland for revenue collection. So we thought it was deemed worthy of a letter of concern.
Definitely.
Okay. Thank you, Mr. Hook. Any questions? I don't see my list. No questions. We're going to vote. Senator Zucker, do you want to start? Just want to, okay. Say not, okay. So we're voting to send that letter of concern to the Compliance Division. All in favor?
Aye.
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 Okay.
Madam Chair, just one other thing before I turn it back over to you. Some of you may or may not have noticed that annually we used to send out a legislative audit bulletin, usually at the first of the calendar year. It was done once a year. It was about 8 pages long. It was a very short publication that listed all the audit reports issued the last calendar year in chronological order, and then summarized some of the findings for a handful of those reports. And the purpose of that document, which was started for 3 legislative auditors ago, was to provide all members of the General Assembly with some highlights of the activity of the office, because most members of the General Assembly are not members of this committee. Last year, I started a process where I have had my staff send out notification to every member of the General Assembly of all audit reports being issued on a real-time basis. So the committee gets the primary distribution of the report, which means you get it before the press does. But every other member of the General Assembly now gets a notification when it becomes a public report. And so they then can look at the report real time, and if they have questions, come to us right away. So I didn't see a need for this very small, brief bulletin when in fact everybody now gets copies of all the audit reports on a real-time basis throughout the year. So I just want to let you know that's why, if you've missed it, which you probably haven't, but that's why it's no longer there. It's been superseded by actual distribution of the audit reports. And that was it. Thank you, Madam Chair and Mr. Chair. Is that that's odd? But anyway, thank you.
Thank you. Thank you very much. So we're up to closing remarks. Chair Lamb, do you have any closing remarks today?
No, I think in interest of time, I just want to thank the auditors for all of your hard work. Sorry about the long meeting. Appreciate you all bearing with us. Thank you.
Yes. Thank you to the auditors. Excellent work as usual. And thank you to all the committee members for hanging in there with us. Thanks.
Thank you
very much. So I think we are adjourned, and